Good afternoon, everybody. I am Sanya, your host for today's live from All About Skin Wellbeing team. I am sure all of you must be keeping good health. Today we are going to discuss about our skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely, and it may due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per the study published in India Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years, and incidence is higher in older age group as well. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types and how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us a renowned dermatologist of India, Dr. Aslam Ali. He is MBBS MD from Guwahati, Assam, and today he will be talking about urticaria. He has rich experience in his field, and his skill and compassion have made a tremendous difference in patients' life. A very warm welcome to Dr. Aslam Ali. It's a pleasure, Dr. Aslam, to have you with us today.
Yeah, thank you so much, Sanya, for the very generous introduction. Good afternoon, everyone. I hope we'll learn something about urticaria today. So we shall start the session today. Okay.
Definitely, doctor. And we are really going to discuss on very important topic that is urticaria and how we can manage urticaria. So first of all, doctor, as we are going to discuss about urticaria, we really want to know that what is basically urticaria, how we can define urticaria.
Okay, so let's keep the discussion very understandable so that everybody can understand. So urticaria basically, by definition, it's appearance of wheals with or without angioedema, which usually lasts less than 24 hours. Okay. So here there are two things. Firstly, wheals. What are wheals? We have to understand. So wheals usually have three characteristics. Firstly, there will be swelling in the skin, which will be well demarcated, surrounded by a erythematous reflex area. And second characteristic that we will have, it will be very itchy. Sometimes there may be associated burning sensation. And the fourth thing is the wheels are transient. That is, they are not permanent. They will start and then they will subside themselves or on medications within 30 minutes. But usually within 24 hours, they will definitely vanish. If it is staying more than 24 hours, then we have to think of other causes other than urticaria. Along with wheals, there can be other symptom, which is angioedema. Angioedema is nothing but a deeper variant where the swellings will be not very well demarcated because the swelling is very deep inside the skin, and they will mostly occur in your soft areas of the skin like eyelids, lips, or any other part of the skin can also happen. And also the angioedema occurs in your mucous membranes, mostly inside your mouth, inside your voice cavity, which is called larynx, inside your GI tract, the alimentary tract. And this can cause serious problems if there. It can cause like breathing difficulty and can lead to an medical emergency also. And angioedema is usually not pruritic. More than itching, it will be more associated with pain and burning sensation. And angioedema usually takes more time to subside. Like it will take anywhere from 24 hours to 72 hours to subside. So the most important characteristic in urticaria is the wheal, which can be present with or without angioedema. And for common people, you can understand like what is a wheal. Like every sorry, everyone must have had a mosquito bite. After the mosquito bite, the elevation in the skin that you see, that is an example of a wheal. It is associated with a central swelling with a surrounding
Okay, doctor. So as you said that it can be related to redness, itchiness, swelling can also occur. These are basically we can define urticaria. Sir, कई बार urticaria जैसे कि आपने कहा for 24 hours, more than 24 hours it resists. Sometimes it cannot be less than 24 hours. So
no,
हम जरूर ये
art-
जानना चाहेंगे. Yes.
अर्टिकेरिया यूजुअली सबसाइड्स, वो यूजुअली 24 घंटे के अंदर चला जाता है। अगर वो 24 घंटे से ज्यादा रहता है तो वो अर्टिकेरिया नहीं है, कुछ और कंडीशंस में ऐसा स्वेलिंग आ सकता है, वो कुछ और कंडीशन सोचना पड़ेगा।
राइट एंड आई थिंक अगर आपको ऐसा कुछ होता है so you should consult your nearby
यस,
dermatologist rather than self medication, right doctor?
यस, डेफिनेटली वेरी वैलिड पॉइंट।
Yes, doctor. We are talking about urticaria, and we really want to know, why it happens. So what are the causes of urticaria? Are there any like symptoms or signs earlier, or what are the causes, doctor, of urticaria?
Okay, so let's discuss the causes of urticaria. But before we know the causes of urticaria, we have to know the types of urticaria. Okay, as you already mentioned in your introduction, there are mainly two types of urticaria: acute and chronic. So, acute urticaria is usually lasting less than 6 weeks, and chronic urticaria will usually last more than 6 weeks, sometimes even years. Again, acute urticaria. The main causes of acute urticaria are like two types. Firstly, it's like idiopathic, where we do not know the cause. Like 50% of the cases of acute urticaria, we will not be able to identify the cause. But the majority of urticaria that we can identify in acute cases is because of some infection. It can be usually an upper respiratory tract infection or a GI infection or any other form of viral infection. And sometimes it can also be precipitated by some drugs, which are usually some painkillers and some opiates like codeine, cough syrups. Also, other medications are there which can cause this. And sometimes some food can also cause, like if you are allergic to shellfish or other food items, that can also cause acute urticaria. Now, coming to chronic urticaria is again divided into two main types. First is a chronic spontaneous urticaria. So, as the word suggests, it's spontaneous. So, most of the causes of spontaneous urticaria we do not know, like it's idiopathic. And then there is chronic inducible urticarias. In inducible urticarias, there is a specific triggering factor which causes the urticaria. So, chronic inducible urticarias are again of multiple types. So, it can be like delayed pressure urticaria, where pressure is the main cause. So, in that, you will get the lesions in the sites where they are subjected to constant pressure. Like you will get it in your buttocks or in your waist area where you put the belt tightly or where you put the straps very tightly. Then there will be uh, cold induced urticaria, which is precipitated by exposure to very cold temperatures. And then there will be like heat urticaria, which occurs after exposure to very much heat. Then there can be aquagenic urticaria, which occurs after exposure to water. Then there is cholinergic urticaria, which occurs after an episode of excessive sweating. Then there can be adrenergic urticaria, which can occur after some stressful episode. Then there will be pressure urticaria already said. Then there can be solar urticaria, which occurs after you go out in the sun after delayed sun exposure. So, and these are the like non-precipitant factors for inducible urticarias. In spontaneous urticarias, most of the causes are not known, but however, it is associated with some of autoimmune conditions, like other autoimmune conditions. So, like 20% cases can be autoimmune in nature, Some forms can be precipitated by drugs, which can be reduced by removing the drug, and other autoinflammatory syndromes like collagen vascular disease and some malignancies can also present with urticaria. So these are basically the broad causes of urticaria. Other than that, there can be some food precipitants that you may not know that you are allergic to can be triggering the urticaria per se. And other than that, I think we have covered all the causes. And majority of the causes still remain to be discovered. So we are looking into it.
Okay, doctor. That means there are different causes of urticaria, acute and chronic. So it depends whether one person have an acute urticaria or chronic urticaria, and still discovery is going on that there what are all the causes. But the main causes, as doctor said, is your food habits, your exercise, temperature change, climate change, and everything. So, doctor, when we are talking about urticaria, sometimes people cannot identify that it is urticaria or not. So how somebody can identify that this is particularly urticaria? How does it look like, and does it look like an allergy, and how one can identify that this particular thing is urticaria?
So basically, for a common person, a skin rash is a skin rash. It can be like small raised, elevated lesions, or it can be like very big, reddish raised lesions, or it can be like flat red rash. So to identify urticaria, the most important criteria is the wheal. So as all, I already described, wheel will be like elevated lesion. It will not be flat, and the central elevation with a peripheral depression. It will be well demarcated, and there will be surrounding area of redness. And second characteristic is that it will be very itchy, and the third characteristic is that it will subside by 30 minutes to 24 hours. It will subside within 24 hours, definitely. If you are having these features along with angioedema or without angioedema, then you are having urticaria, and you should definitely see a qualified dermatologist for your concern.
Right. So you have to see a dermatologist if you are facing such kind of irritation on your skin or redness on your skin. And as doctor said, swollen parts, and it can from like 24 hours. And if you have something which is more than 24 hours, you have to consult a dermatologist. And as doctor, we have discussed about two types of urticaria, that is acute and chronic. We would really love to know that what are basically chronic urticaria hives, and are they dangerous? And how will they go away? How they can be treated?
Okay, it's a very broad question. Let's break it down into parts. So, like, what is chronic urticaria first? So, if you are having this wheels for a period which extends more than 6 weeks, like it started and then subsided, started again, subsided again, and this episodic episodes of wheels keep on continuing for more than 6 weeks, then we classify it as chronic urticaria. Again, chronic urticarias can be a lot of different types, like chronic spontaneous urticaria and chronic inducible urticarias, which I already discussed. And the next part is like whether it's dangerous or not. So chronic urticaria per se is a very distressing condition. Like it can cause a significant amount of itch. It will definitely hamper your quality of life. You will not be able to sleep properly if you get the hives at night. Uh, but it's not very dangerous unless it is associated with angioedema. So, if you are having angioedema in your mucous membranes, mostly your larynx, which is the voice box, or in your GI, then the symptoms can be severe and it can be a medical emergency requiring urgent attention. Otherwise, you will suffer from uh, inability to breathe, and which will cause serious uh, concerns. Like it can also be fatal if not treated in time. So that is the only serious condition. in urticaria. Otherwise, urticaria per se is a distressing condition, but not life-threatening.
Okay, so urticaria is not life threatening, but if not treated well, and if you do not go to a dermatologist, then it might can be something. So do not ignore it. Do not take self medication. Go to a dermatologist. That is very important. Doctor, when we are talking about urticaria hives, as you mentioned, there are types of urticaria. What are the potential complications of urticaria if left untreated? If somebody do not treat the urticaria, what will be the complications?
Okay, so the main thing about urticaria that it is very distressing. So, as such, there is no serious uh, long-term complication. However, it will lead to a reduction in your quality of life. If you are not able to sleep properly at night because of the itching, it will accumulate on a daily basis and it will hamper in your day-to-day functioning. And other than that, the other serious complication, if it is associated with angioedema, it can be life-threatening at some times. And other than that, if you don't treat urticaria and it keeps on, unless if it is associated with some other autoimmune condition, then it can also be present in your other body systems with other autoimmune manifestations like autoimmune thyroid conditions and other collagen vascular diseases. Then on long term basis, you can suffer from other systemic complications like thyroid and kidney problems like that. Otherwise, it's a very trivial condition. But only problem is it will hamper your quality of life if you don't treat it.
Okay, so if you don't treat the urticaria, it will definitely hamper your lifestyle, your life. And doctors, sometimes we have seen, that the people who have urticaria, or sometimes it suddenly occurs, when they go out, they started feeling itchiness, they started feeling like scratching, their hand. We would really love to know that, if somebody is going out, what precautions somebody should take, if they are allergic to something, so what precautions they should take?
Okay. So, as we already discussed, there are like two types of chronic urticaria, so spontaneous and inducibles. So, a person suffering from chronic urticaria should ideally keep a diary, maintain a diary, or we can give them urticaria activity score charts to fill up, and they should ideally maintain a food chart like what they are eating per se and on which day it aggravated so that they can identify this food cause this. And second thing is that they should not wear very tight clothes because pressure is a definite triggering factor in delayed pressure urticaria. So wearing tight clothes is definitely not advisable. They should wear loose clothes with proper airflow. And thirdly, we should not go out in very harsh sunlight because sometimes sunlight and sweating can trigger your urticaria. So try to keep your skin cool and calm. And if you are having like cold urticaria, then you should avoid going in very cold places. You should wear proper clothing to keep you warm. And if you have cholinergic urticaria, then do not exercise very vigorously without proper cooling available. And in case of adrenergic urticaria, you should avoid stress and have a proper sleep. Uh, if you are having some emotional situations, try some meditation techniques to keep you calm. Uh, Other than that, other skincare routines you should follow regularly. Do not use very harsh soaps or detergents on your skin. Use a mild moisturizer regularly. Keep yourself hydrated. And if you know this food is triggering your urticaria, then you should ideally avoid. And there are some food items generally which can trigger your urticaria, which contain more amount of histamine because this histamine molecule is the main triggering factor in urticaria. So You can go for low histaminergic diets, basically, which should avoid all sort of fermented foods like alcohol, curd, cheese, which are produced from fermentation of milk, kimchi, and other fermented pickles, and other uh, seeded fruits and vegetables like brinjals, tomatoes, and seafood like that. And you should also go for a pseudo allergen free diet, which is usually avoiding chocolates, tea, coffee on a higher volume.
Okay, so these are the precautions, as doctor said, you must take not much of everything, coffee, tea, and preparing yourself quite nicely so that urticaria, as doctor said, can be happen at any time. Spontaneous chronic urticaria can happen due to different reasons. Doctor, as you also mentioned that people should not take stress, and in today's life people are taking stress, as you suggested, at meditation and yoga is must. But my question is that do really stress causes urticaria, and does it look different, or what are the measures we can help to protect or to prevent the stress urticaria?
Yeah, so the stress can definitely cause adrenergic urticaria. If you are having urticaria, stress is a definite precipitating factor. So the lesions will differ from usual urticaria in stress adrenergic urticaria, because the lesions will be very small in adrenergic urticaria. They will not be as big as a normal chronic urticaria, and it will happen after a emotional outburst or something like that, and when you are very stressed. And so to avoid stress, you should learn like meditation techniques, and which can keep you calm. And in moments of emotional stress, you have a quick access to those techniques, and you can use to calm yourself down. Other than that, you should also try and avoid how far as possible high confrontational situations. Get proper sleep, and keep your life as stable as possible. We know these days it's very difficult, but all we can do is try. And as you already said, do some meditation, do some yoga.
Yes, definitely, doctor. So, as doctor said, it is difficult to be stress less, but you should try because stress can also harm your body, and you can get urticaria due to stress as well. So, be less stress and do yoga and meditation.
Easy to say.
Doctor,
Easy
doctor,
to say, be less stressed.
yes, yes, doctor.
It's easy to say to be less stressed, but everybody is taking so much stress these days. You
Yes,
can
and
call
I
it a stressed generation.
stress generation, but I think due to we are having such live sessions, so that you can definitely give the message to all the viewers that be less stressed, and we are trying that they operate a good lifestyle, a healthy lifestyle. So yes, doctor, we also have a live viewer questions. The viewers who are watching this live are also having some questions. So we have Sonam Sarathe here asking, should I consider over-the-counter and antihistamines for my hives, or do I need prescription medication?
Okay, so now see, using over-the-counter medications for isolated episode is still fine, which I would not advise, but you can still get away with it. But if you are having a chronic urticaria, you need to document your medication. You need to know what dose you are using, whether that dose is working on you, or we have to updose it, or this medication is not working for you, we have to switch it to another molecule. So for that, you should ideally take advice of a qualified dermatologist, so that you can monitor your treatment. Because the chronic urticaria is a very distressing symptom, and it will stay with you for a long period of time. Taking over the counter medication will not solve your problem, because you don't know what dose you are taking, and whether the dose is appropriate or not for your condition. So What we do is like we start you on a second generation antihistaminic. If it is controlled and your urticaria activity score is going down, which we will monitor on a regular basis, then we can continue with that medication for a longer period of time. But if you are not responding and if the symptoms are getting worse, then we have to updose it, or we have to switch the molecule. Or if you have angioedema, we have to give another rescue therapy in the form of corticosteroids. Or if you are not responding to antihistaminics at all, we have to consider about monoclonal antibodies like omalizumab. And if you are not responding to that also, we have to give you immunosuppressants like cyclosporin and other drugs. So it's ideal to see a dermatologist for your concern and avoid over-the-counter medications as far as possible.
Yes, I hope Sonam, you will definitely go to your nearby dermatologist because, as doctor said, don't take over-the-counter medication. It can be harmful for you. Doctor, sometimes it happen. I think many times people, if they have itchiness or redness, they don't go to a medical store, ask for medication, and sometimes the symptoms get worsened. I think that is everybody should not do, right, doctor?
Yeah, definitely. Suppose you are not getting an appointment or something like that, then you took one pill and it gave you a little bit of relief, but don't make it a habit. Please nip the problem in the bud only. Don't make it a big problem.
Right. So precaution is always better than the cure. So be prepared and don't go to your nearby medicals. Go to a proper dermatologist if you are facing such problems, especially urticaria, if you have itchiness, redness. Doctor, we have another viewer question, Advik Singh, asking, can urticaria be a symptom of an underlying medical condition?
Yeah, definitely. As I already told, because some conditions can cause urticaria, like other autoimmune conditions can definitely present with urticaria, collagen vascular disease, autoimmune thyroid disease, and other. There are some urticaria syndromes also which present with urticaria, like Snitzler syndrome, underlying monoclonal gammopathies. So, if your urticaria is like presenting with long-standing symptoms and not subsiding on uh, antihistamines, definitely we have to evaluate for these causes.
Right, doctor. And doctor, we have talked about the urticaria, its symptoms and causes. We would really love to know that what are the treatments which are available for urticaria, be it acute or be it chronic? What are the treatments which are available for this?
So, the first line treatment for urticaria, be it acute or chronic, is second generation H1 antihistamines. So, there are many drugs available in the second generation H1 antihistamines, starting from cetirizine, levocetirizine, uh, belastin, fexofenadine, uh, loratadine, desloratadine. A lot of uh, armamentarium of drugs are available. And if it's not responding on H1 antihistamines, we can add on H2 blockers like cimetidine, ranitidine, famotidine. And even if it's not responding on that, we'll have to add a second group of drug. By protocol, we should start with a monoclonal antibody. If we are not getting a response on a 4 times updosing of a antihistaminic, we should switch to a monoclonal antibody like omalizumab. And even if that is not giving proper response, then we have to go for some immunosuppressive therapies like cyclosporin, methotrexate, and efavirenz. And sometimes, if the symptoms are very severe, then only we use some corticosteroids, glucocorticoids, for a short period of time. Glucocorticoids are not advised as a long-term therapy in urticaria. They are only advised to be used as a rescue therapy for short term in cases of severe symptoms. There are some other adjunctive drugs also available, but they are not uh, They should not be used as a first line.
Okay, so these are the treatments which are available for urticaria, and it can be treated. So if you have any such kind of symptoms, you should definitely refer to a dermatologist. Doctor, sometimes it is like that when somebody is having urticaria, or when other people see it, they feel that we should not go nearby to that particular person, or we should not we should be away from that person because he's having the redness. He's like continuously, because of the itchiness, he's scratching his hand. So my question to you is that, is urticaria contagious?
No, let's bust this myth. Articaria is not contagious. It's not communicable at all. It's your internalized autoimmunity or allergy, whatever it is, uh, and it will not transfer from you to other person. So don't discriminate against itching people unless you know the condition. So in urticaria, it's not usually communicable. You can safely stay with them, play with them.
Yes, so as doctor said, it is not contagious. So next time you see somebody, you should ask them to refer a doctor rather than staying away from them, because as we have already discussed, urticaria is treatable. It can be treated. Doctor, we have seen that in COVID, there were a lot of complaint that after the steroids, because high medication were taken, some people have hives after that. So, can COVID cause hive, and can hives be on the face as well?
Yeah, so a lot of studies were done during the COVID era, and urticaria is a definite association with COVID. Some 20% of people having COVID will also have urticaria. So, and that urticaria can occur anywhere. It can also occur in your face. It can also occur in your body. But the thing is, if you get treated for the COVID, that urticaria will also subside. So, no need to worry.
Yes, so you don't need to worry. It is also curable and treatable. Doctor, we were talking about the urticaria only and precaution symptoms. Deepak is here, our viewer, Deepak Saxena, asking, are there any specific precautions I should take? I have chronic urticaria.
Yeah, hello Deepak. See, first you will have to identify uh, what is triggering your urticaria. So you should maintain a food chart, like what things are you eating, and you should also maintain a log of your lesions. Like there are urticaria activity scales available online. You can Google it, like urticaria activity score 7, and you keep on filling it, and you will know whether your urticaria is getting better or worse if you keep on continuing that. Other than that, as a general term, uh, uh, you should avoid foods with high histamine, which I already mentioned, like fermented foods like alcohol, fermented pickles, fermented cheese, curd, uh, foods high in histamine like tomatoes, brinjals, seafood, nuts, all these things you should avoid. You should wear very loose fitting clothes. You should not put pressure on a particular body area. You should avoid too cold, too hot temperatures. You should use very mild soaps, and should use a regular uh, skin moisturizer. Keep yourself hydrated and meditate.
Yes. So Deepak, you have to take these precautions as suggested by doctor. Stay hydrated, wear loose clothes, and don't go from very cold to very light climate. Doctor, as some people have allergies to some specific nuts or ginger. So does taking such things which already you are allergic to increase the chances of urticaria?
Yeah, definitely. Uh, if you know that this food will cause uh, allergy in you, it has caused allergy in you in the past so many times, and you have identified that this food item is causing allergy to you, causing urticaria in you, then you have to break this toxic relationship with this food. Leave it. There are so many foods available. Switch to another healthy food which will not trouble you.
So switch to another food, because if you already know that this particular thing, if you eat, can cause some harm to you, please avoid that. Doctor, we have seen it many times, when people have redness or they have itchiness, they, apply some products and which also worsen their urticaria. We have seen that usually in summers when people have redness, they apply some powder to it and think that, it is due to sweat or something. So, is it required that somebody, if you're using some product, you should test it first and then should apply it to your skin?
Yeah, so all the cosmetics that are available non-prescription should be ideally tested over a small part of your skin before you apply it as a generalized product all over your body, because that may worsen your condition. And the products that are available on prescription, usually we apply calamine over the rashes to calm the itch. We can also give uh, moisturizers and other soothing agents so that the itch goes away. But however, it will not take care of your problem. You will have to take oral medications. Only application of something will not cure your urticaria. So that will be like supportive management, but not a definite cure. So
Yes.
I would advise not to apply very harsh, unknown products to cure your urticaria. And you can use calamine-based lotions uh, if you are having some distressing symptoms. But consultation with a dermatologist is a must.
Yes, consultation is must, as doctor said that it is required to consult and do not apply something which is harsh to your skin. Doctor, we have seen that many people complain that my urticaria is worsen at night, and there's a lot of itchiness and in night. Does it happen, and why do hives or urticaria are worse at night?
Uh, it's not the time of the day which is causing the urticaria, but the other factors like if the temperature is going down at night, or if you have worn very tight clothes throughout the day and continued in the night, which you are taking off, then you will notice that these lesions are coming up now. Or you have had a very stressful day, which will culminate in the night, and then you'll start noticing the symptoms. And if there is a break in your last antihistaminic dose for very long, like the last dose you took the previous night, and you went entire day without the medication, and there is wearing off of the effect of the medication, then also you can get. So it's not particularly the time of the day, but other factors which are causing this arterial symptoms coming more in the night. So if you take care of these things, then definitely you will get uh, relief from your symptoms. And ideally, you should, if you are taking a uh, long-lasting antihistaminic, then once daily dosage is usually sufficient. But if you are taking a short-acting antihistaminic, then multiple times you will have to dose. So that will be adjusted by your dermatologist, and you can take other general measures so that you don't get stressed out through the day. You don't consume very much chocolate and coffee throughout the day. You don't sit in one position throughout the day. All that, if you take care, then definitely you will get benefit uh, of this nighttime urticaria that is happening to you.
Yes, right. So taking good care of yourself is very important, and Dr. Aslam said. Doctor, when we were talking, you said one should not take coffee and tea more amount. So we would really love to know any dietary precaution or do's and don'ts for patients of urticaria.
Yeah, definitely. If you have identified some food item as causing triggering your urticaria, you should avoid that. Other than that, high histamine containing foods like fermented foods, beverages, alcohol, fermented pickles, curd, cheese, high histamine containing foods like tomatoes, brinjals, all this should be avoided. Other than that, pseudoallergen containing stuff like chocolates, coffee, tea, all this should also be reduced.
Okay, so these are the do's and don'ts for someone who already have urticaria as by doctor. So you should take good care of yourself because it is important and you have to consult a dermatologist if you are having any such problem. Doctor, before we end this live session, any takeaway message for all our viewers watching this live right now?
Okay, so thanks for being patient and listen to all this jargon that you have been subjected to. But if you are having urticaria, I would uh, like to tell you that your condition is not permanent. It will go away someday. Uh, but the only thing is that you have to take proper precautions for yourself. You have to maintain a healthy lifestyle. You have to consult a dermatologist, get started on medications, and you should not stop medications on your own, or you should not self-prescribe yourself. You should not increase or decrease the dose of the medications on your own. Like if you feel like, oh, my symptoms are getting better, I will reduce the dose now, or I will try skipping for 3 4 days and see whether it comes back again. Don't experiment. We are here to experiment. So you just consult your dermatologist and continue the medications for as long as they prescribe you. Yeah, and you revisit them and say that my symptoms are going down. Do I need a taper in my medications? Then they will definitely taper it down. And we have to stop these medications gradually. Any abrupt stopping the drugs will cause re-emergence of the condition. So please do not stop the medications abruptly and maintain a healthy lifestyle and get released from this age of urticaria.
Right, definitely. And what a very beautiful message that do not stop medications by your own because, as you said, that people see that their urticaria is getting better, they stop the medication. But as suggested by Dr. Aslam Ali, that do not stop your medication. Go to your nearby dermatologist and consult your dermatologist if you have urticaria. Thank you so much, Dr. Aslam Ali. It was really wonderful having you today.
Thank you so much.
Thank you so much, Doctor, for your valuable time. And it has been a very informative session for our viewers. And I am sure that they will definitely use this information to prevent themselves and their near and dear ones from getting urticaria. And in case they get it to see such symptoms, which we have already discussed, they now know that instead of self medication, they have to consult their nearby dermatologist. Thank you so much, doctor. We really look forward for many more such sessions in the coming time for our viewers.
Thank you so much.
And thank you so much, viewers, for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you so much, everybody. Good day to all.